Good morning, and thank you for attending. Dr. Chirico is off today. Today, I am joined by Shannon Mantha, Executive Director of Clinical Services and Chief Nursing Officer, to give an update on our local COVID-19 situation, and Andrea McClellan, Director of COVID-19 Immunization Strategy, who will provide an update on the COVID-19 vaccine rollout. Before we proceed, I would like to take a moment to acknowledge that the health unit resides on land covered by the Robinson-Huron Treaty of 1850. This land is the traditional territory of the Anishinaabe people. This land is also part of the unceded territory of the Algonquin Nation. I would also like to acknowledge the Métis' historical presence in this region. I encourage everyone to continue on your journey of learning as we work to contribute to the process of reconciliation. We are now 2 weeks into the vaccine certificate program, and I want to thank everyone. We have had great compliance. Please note that at this time, there is not a provincially endorsed QR code for the vaccine certificates. Once the province releases their QR code system, we will share the information widely. This weekend, many people will be celebrating Thanksgiving. We are thankful that in-person gatherings are able to take place, but I encourage everyone to consider the risk and follow public health measures, including gathering limits of 25 people indoors and 100 people outdoors. Do not attend gatherings if you feel ill or have symptoms of COVID-19. Stay home and arrange to be tested. Consider requiring all individuals attending a Thanksgiving event indoors to be vaccinated. Consider celebrating outdoors if possible, especially with individuals who are not vaccinated. More space means less risk. Consider celebrating virtually, especially if family members are at increased risk of severe illness, such as elderly, people with medical conditions, weakened immune systems, etc. With that, I will pass it to Ms. Mantha to give a local COVID-19 update.
Thanks, Dr. Zimbalati, and good morning, everyone. So in the last 7 days, we've had 25 new cases. This brings our total case count to 775, with 542 of those cases being in the Nipissing district and 233 in the district of Parry Sound. The health unit currently has 28 active cases. There are currently no active cases that have screened negative for mutations. And this means that these cases are presumed to be Delta variant, as the Delta variant does remain the dominant variant in the province of Ontario. Some of our new cases are still awaiting further testing. Currently, there are no individuals in our district in the hospital due to COVID-19. Since June the 1st, 65% of individuals eligible for the vaccine who tested positive for COVID were unvaccinated, while 22% were partially vaccinated. And 13% of cases have been identified as breakthrough cases, and this means they're individuals who tested positive for COVID-19 and were fully vaccinated. Furthermore, 36 cases were born in 2010 or later, and as a reminder, these individuals are not yet eligible to be vaccinated. Since the beginning of the school year, there have been 10 cases among children who attend a school or a childcare. However, it's good news that no outbreaks have been declared locally, meaning that we have not seen transmission of COVID-19 within the school or childcare settings. We have declared an outbreak of COVID-19 in a church community. Through case and contact management, all high-risk contacts have been notified, and close contacts were notified very quickly, and follow-up was done very quickly, thanks to the great work and cooperation of the location. And as we always say, should we identify that there is a COVID-19 risk to the public, we will let the public know through a news release and other channels. Now, back to you, Dr. Zimbalati.
Thank you, Ms. Mantha. I would now invite Ms. McClellan to provide us with an update on our vaccine rollout.
Thank you, Dr. Zimbalati, and good morning, everyone. As of yesterday at 3 p.m., we are now at 85% of residents 12 years of age and older who have received at least one dose of a COVID-19 vaccine, and 79% of residents 12 years of age and older who are fully vaccinated. 80% of youth 12 to 17 years of age have received at least one dose of COVID vaccine, and 69% have received both doses. As of yesterday at 3 p.m., a total of 187,744 vaccinations have been provided in our district. The current target does remain to be 90% vaccination rate for both first and second doses. To achieve this, we need to administer 5,743 additional first doses and second doses to those who have not yet received a vaccine, and a total of 6,698 second doses to those who have already had their first dose. We have had great success with our mobile vaccination clinics. As of October 4th, we have administered 848 first doses, 1,080 second doses, and 66 third doses to those who are eligible through our mobile vaccine clinics. We're reaching people we don't believe we would have been able to reach without the bus, and we continue to visit locations throughout the district in the fall. Please check our website for clinic dates and times. Now back to you, Dr. Zimbalati.
Thank you, Ms. McClellan. A reminder that our press conferences will now be held bi-weekly. Our next press conference will be October 21st. That's it for our prepared remarks. Now we'd like to begin answering your questions. If you have questions, please type them into the Q&A at the left of your screen. Our moderator will read them aloud, and we will try to cover as many as we can. When possible, please ensure your name is attached to the question. Alex, please read out the first question.
Thank you. Our first question is for yourself, Dr. Zimbalati. It comes from Eric Tashner from CTV News. Last year, Dr. Chirico gave out ideas for a safe Halloween. For example, he offered a small family party instead of going door to door. What is the health unit's stance on trick-or-treating this year? Is it too soon? Any decision on this? Is there a decision on this for the health unit asking families to or not to go out?
We're still reviewing trends, and we're still looking at what the full effect of return to school will be, as well as we need to see what the impact is after the Thanksgiving long weekend. So we will be developing some suggestions and guidance in the coming weeks, and we will release that when we have finalized that.
Thank you. Our next question is also for you, Dr. Zimbalati. It comes from Jennifer from The Nugget. I understand the province is announcing no face coverings will be required for indoor areas that require people to be fully vaccinated. Does the health unit have any comment or concerns with these changes?
Obviously, we will continue to enforce and support Ontario measures and Ontario guidance. However, everyone is welcome and encouraged to do their own risk assessment. And if they feel that they may be at higher risk because of an immune compromising condition or other factors, and if their personal comfort level is higher with a mask on, I think that would be perfectly acceptable and encouraged to continue to layer your protection. However, if adequate physical distancing can be maintained, then it is possible in certain situations that masks won't be necessary. But I think the evidence will have to continue to be looked at, and if there is evidence of increasing transmission in those settings, even among vaccinated who are not wearing masks, then we would have to revisit that guidance.
Thank you. Our next question is for Andrea. It comes from Sarah Bissonnette at Parry Sound and Almaguin. How is the health unit encouraging the final unvaccinated long-term care home staff to get vaccinated ahead of the November 15th deadline?
Thanks for that question, Sarah. The health unit continues to work with our long-term care home partners to facilitate information sharing, to ensure access to vaccine, and to promote individuals who are unimmunized or not fully immunized to receive that vaccine. So we take our lead from the support that the long-term care homes require from us, and are actively providing that support on an ongoing basis.
Thank you. Our next question is also for you, Andrea. It comes from Rich Coffin at My North Bay Now. Based on current vaccine levels, is there a guesstimate on when we'll reach 90% of our eligible population vaccinated?
Thanks for that question, Rich. I'm not a mathematician. I will give you a guesstimate. The goal provincially is by the end of December, and I think that's a reasonable goal for the province. Locally, I'm hoping in December, based on the uptake that we've had over the last little while, and with the success of our mobile clinic and being able to get to some of those areas we don't historically have ability to get to. I think December is a reasonable target for sure. Thank
you. Our next question is for Dr. Zimbalati. It comes from Sarah Bissonette from Parry Sound and Almaguin. Would the health unit like to see the province make vaccinations mandatory for those working with those most at risk, such as the elderly, as we head into winter?
Thank you, Sarah, for that question. In certain settings, it has been mandated, such as long-term care. As of October 1st, long-term care staff members do require vaccination to work. And I think really this obligation extends to our whole population. If we're working with, for individuals working with any vulnerable individual, whether they be elderly individuals, whether they be school children, whether they be individuals with other vulnerabilities, I think as a community, we have a duty to protect those who are vulnerable, and especially those who cannot be vaccinated themselves.
Thank you. Our next question is for Shannon. It comes from Jennifer from the Nugget. Why were spectators allowed to watch their kids play summer sports, yet high school sports don't allow spectators? I know it's the school board's decision. However, I understand the health unit is supportive of this measure.
Sure, yeah, thanks for that. So definitely the health unit is supportive and supporting our local school boards as they navigate and find balance between providing activities for students and extracurricular activities, as well as, you know, keeping students safe and keeping COVID-19 transmission low. So ultimately, school boards are accountable both to students as well as parents and the community for the health and safety of students, and they don't take that position lightly. So, you know, when activities are offered during school hours as well as right after school, parents and the community expect the school to have provided a safe environment. So there have been two key priorities for school boards that, you know, working as partners that we understand. One is returning students to in-person learning as well. And the second one is supporting students to return to all those great activities associated with school that promote their health and wellness. And both of these priorities have been set up in a way to reduce the risk of COVID-19 transmission among students and staff. And we're supportive of the balance that they're trying to find on an ongoing basis, and definitely supportive of the current decision.
Thank you. So that completes all submitted questions. As discussed at last press conference, we will be moving to a bi-weekly model. So our next press conference will take place on Thursday, October 21st at 10 a.m. Thank you.